now. Right. Here we go. All right, welcome everybody. We'll just give it just a few minutes just to wait for people to trickle in here, but we'll start in just a minute here. All right. Okay, all right. Well, welcome everybody to this brief chat we have today with Dr. Matias Golob. So if you're not familiar with 12 Weeks to Wellness, who's hosting this today, we are a health and wellness coaching company. We deliver nutrition and wellness coaching to employees and organizations across the country, coast to coast in French and English. We also work with organizations on helping them design and develop and deliver wellness programming. So today I am very excited to have Matias here. So Matias is the principal of Connected Workplace Wellness, a Canadian-based company established to accompany and support enterprises in the design and management of corporate wellness infrastructure and programs. He's a subject matter expert in people-centered health promotion. Matias subscribes to the idea that corporate wellness initiatives should be designed, implemented, and evaluated with the consultation and participation of the intended audience. His projects span both the public and the private sector and several industries. As a social entrepreneur, Matias has launched 2 additional businesses driven to make wellness accessible for hard-to-reach populations. He also teaches, volunteers on boards, and loves to spend time outdoors with his 2 young kids. Today, with the snow day, just like me. Welcome, Matias.
Thank you. Thank you for that introduction.
It's so great to have you today, Matias. I know this is a topic that both you and I are very passionate about. You know, I've been in the industry for over 25 years. And certainly our understanding and our knowledge around the importance of inclusivity and corporate wellness has increased over the years. And so corporate wellness programs can fail for various reasons, as we both know. But there's really one central issue that's plagued wellness in the workplace for ages and really contributes to that lack of success that we sometimes see. And that is that we try to treat everyone the same and provide them with the same set of wellness offerings, whatever that might be. And it really is way more than about employing the people of different races, religions, or sexual orientations. As a matter of fact, last week we did an event where we talked specifically about the issue of focusing on weight in workplace wellness and how that is really pervasive in the wellness and fitness industry and in corporate wellness and has been forever. And so, but it doesn't stop there about the stigma that comes with that, of course, Matias. So what are some of the key issues around inclusivity and workplace wellness that you're seeing in the work that you do with organizations?
Thanks, Emma. Yeah, and I mean, having said what you said, I believe, you know, there's one key point that we have to address to start with, and that wellness is for everyone. And I think that's one point I want to drive home when we talk about inclusivity, because understanding and applying wellness in terms of you know, initiatives we employ at the corporate level can and does impact what that means and how people understand it. And so if we start with that, we can then continue on to understanding that what we ought to do as leaders, as professionals in the field, is really step back, get out of the way, and enable individuals, whether these are hard to reach populations or just in general population and workforce, to participate as partners in the development of any and all initiatives. And I think that speaks at the heart of inclusivity, because I think when we talk about problems or issues, part of the problem is that we have a diverse range of audiences who have different needs, and meeting all those needs through a specific program or initiative is just not possible. And so understanding that perhaps we need to take a step back may be the most important thing we can do. So if I go back and we start with that idea that wellness is for everyone, what does that mean? Well, I want to drive that the definition of wellness isn't in itself inspiring us to change. It's such a powerful concept because wellness, it implies self-transformation. It implies the capacity for all of us to make changes. to deliberately take actions to improve our health, our well-being, our happiness. In essence, wellness is very powerful because we all have the capacity to participate in deciding what outcomes we want to achieve, what things we want to do to change. As we know, though, our wellness efforts we're not always the architects of our wellness efforts. We're influenced by the society in which we live, particularly in our connected society. And in today's society, everyone sells you wellness. So if I may, a car company will sell you wellness. Go out, buy a red convertible, drive it out there, and you're going to be super happy. Or eat this or do this, and you're going to be happy. Wear these clothes, buy these beauty products, and you're going to be happier. Take this pill and you will prevent this disease. So we are bombarded on an everyday basis with products and services that can help us improve our health and well-being. And so we are participating in those acts of change on a daily basis, sometimes not deliberately. And that's where the deliberate action is where we have to focus on is what are the deliberate actions that we take to improve our health and well-being. Now, having said that, corporate wellness is also, or I should say companies are also in the business of shaping behavior. As we know in many instances, corporate wellness programs function under the guise of disease prevention initiatives or prevention initiatives. And so the focus of these programs is more about how do we curtail expanding healthcare costs? How do we reduce absenteeism? In this way, we're not only limiting and constraining, I should say, what people and how people understand wellness, we're also disenfranchising them. We're making them active resistance to what we're offering because we're saying wellness is one thing, when in truth, wellness can mean so many different things, and the actions people can take can be so many different things based on circumstances, based on culture, based on identities. And so we really ought to reflect on what we are offering through a corporate wellness program. Notwithstanding the positive intentions and impacts of disease prevention initiatives, we do not see participation rates that would suggest that these initiatives are making a great impact, particularly with hard to reach populations. Most companies will see participations in the areas of 20%. And when we look at those that are highest risk for disease and other ailments, these tend to be minority and undervalued populations, and these populations participate even less. So what we really need is we need to reconsider and reframe what corporate wellness initiatives aim to achieve. And in my experiences in working with different number of clients, we have found that the key is engaging employees as partners in designing, implementing, and evaluating wellness initiatives. So what does that mean? And how do we do that? Because I think that's what I want to now focus on is breaking down a bit more that element of engagement. So engagement really is about participation. So we are talking about participatory approaches in corporate wellness. And this is something that I've also studied and really been interested in when we talk about people-centered health promotion, because when we want to achieve solutions that will affect the intended audience, we really need to work with them rather than for, right? We can't go in there as experts and decide what is true, what is important, because in that instance, we're already telling individuals that their knowledge is not valid. We're telling them that their interests and needs are not valid. We're saying that what we think is important, that what we believe is of utmost importance is what you should be trying to achieve. So here, when we look at participatory or methods or approaches, we're really fundamentally opposing top-down models. We're saying that we want to go bottom up, we want to consult, we want to engage those who are intended, and we want them to be co-creators in the process of designing, implementing, and evaluating initiatives. This is really important, again, when we consider our roles as experts, as leaders, and what role that has in our society, and particularly in our companies. So one of the things that I would stress is that we ought to, as leaders, as experts in wellness, critically reflect on what we are pushing when we create initiatives and why we are pushing those initiatives and what impacts we're having, not only in terms of, for example, health outcomes, but perhaps in terms of how people view corporate wellness initiatives. And this is something that most companies are blind to. Most companies believe that their wellness programs delivers a return on investment, but they're actually blind to how employees actually view, let alone embrace, their initiatives. And that's where we need to pay more attention to, because that's the empirical research tells us that, you know, a great percentage of a population is not participating actively. And so we should be looking at reframing the initiatives and understanding how we can bring in these individuals as co-partners. In our work with both small and large employers, we have found that participatory approaches have achieved substantial improvements both in engagement and participation. They have created safe spaces for innovation, which is really, really interesting. This is something that, you know, when we do participatory approaches, one of the risks, if you will, is that you don't know the outcome per se, right? I mean, we can't say, well, we're going to work towards achieving reduced disease in the workforce, because as a result of what we do in engaging as partners, we are creating spaces for the voices and perspectives of these people to come out and inform what we do. And that information, that knowledge will generate new outcomes, new ideas. And that's a wonderful thing about co-creation, is that you're innovating. So we have found that our participatory approaches have led to some really interesting innovations in terms of how technology is used to manage and deliver corporate wellness programs. And that's been really useful. We have found that the technology, for example, has been used to harness the power of individuals, as opposed to asking them to participate in completing things like a health risk assessment or a challenge. What we found is that people want to have opportunities to share their own skill sets, which is really important thing to consider. Again, in a co-creation and people-centered, is we want to encourage individuals within a workplace to share skill sets, to share their perspectives with others. That creates a culture of belonging, of inclusion, and fundamentally addresses one of those big issues that we talked about, which is lack of engagement and how to tackle inclusivity. So I think the message here is we need to almost try to stop tackling the problems, addressing and creating solutions as experts, and we need to start engaging the people who we intend to target in order to make a difference. I will say one last thing. I know I could talk on for a long time, so I'll
We'll have you back, Matias.
It's very important, if you intend to use participatory approach to engage, that you pay close attention to how people are engaged. Again, if we bring people together in a group, we need to ensure that whoever you are as an expert, you're not leading the charge. You're facilitating, right? So your role is not to come in and act as an expert. Your role is to facilitate, to listen, and to really be impacted by that. So the key thing when we're engaging is having an open mind to others' perspectives, and creating a space where you're learning with, about, and from others. And I think that's a very important to make in order to understand that we can be the ones that get in the way when we try to engage employees.
Well, thank you so much, Matias. I love everything that you said, and it gives me goosebumps a little bit. Because it's so true that what you're saying about that, you know, we offer a variety of different wellness initiatives. Very likely, most organizations do, and we think that, you know, just because we're offering a diversity of wellness initiatives, that, you know, people will pick and choose what they want to do with that. And but what we're missing is that there may be some of these initiatives that actually have unintended consequences, in that they're increasing stigma for individuals as well, and biases in the workplace. And so that's something that we always need to have that lens on whenever we're initiating any wellness initiatives, right? Like, how is this going to be perceived, and is it going to in any way increase conversations and focus that is going to increase stigma in the workplace? So I love that. So thank you so much for all the value that you created here. And I do think that we'll probably need to have another chat where we dig deeper into this. It is such an important topic, and something that I think that we'll be talking about much more going forward. Matias, where could people learn more about Connected and you? And yeah, do you want to share the website maybe?
Sure thing. Yeah. I mean, we have a website, Connected with a K, where you can learn more about our solutions, our products. We're launching just this month a blog and a newsletter where we're hoping to inform HR professionals and wellness experts specifically about issues associated with diversity and inclusivity. And really, our intentions at Connected are to open up new frontiers in terms of how wellness is accomplished and how wellness is promoted in the workplace. And so we invite you to come on and learn from some of our practices and engage with us in order to create a society where wellness is for everyone.
Yeah. And please check in with us on LinkedIn as well. We will continue this conversation. And if you want to jump on a call at any time, just maybe send us an email, info@wellweeks2wellness, or connect with us on LinkedIn. We would love to hear from you. And yeah, let's keep this conversation going. Thank you so much, Matias. Thanks for coming.
Thank you very much for having me.